Hi, I'm Dr. Tracy Larson. Today I'm talking about prediabetes, which is a condition of insulin resistance that greatly increases a person's risk of progressing to diabetes. This is important because about 1 out of 3 adults in the United States have prediabetes, according to the CDC. If somebody has prediabetes, they have about a 77% chance of progressing to diabetes in their lifetime, and even up to 25 to 50% chance in the next 5 years. Many studies have shown that there are certain things we can do in our lifestyle to decrease our risk of prediabetes and even to reverse diabetes. There are a lot of risk factors we cannot control, such as our age, our ethnicity, and our family history, or who our parents are. If you have one parent with diabetes, it increases your risk of diabetes by 2 to 3 times. If you have 2 parents with diabetes, it increases your risk by 5 to 6 times. And what I'm talking about is really type 2 diabetes or adult onset. Some of the risk factors that we can control really can be altered with our lifestyle, such as exercise. A sedentary lifestyle has been shown to increase the risk of diabetes, so it is recommended to get about 150 minutes at least per week of moderately vigorous physical activity. Another important factor is our diet, particularly now with all the processed foods and added sugars. Eating something like a Mediterranean diet will decrease the risk of diabetes as well as many other chronic diseases. Sleep is also important. There are many studies that have shown that getting around 7 to 8 hours a night of sleep will decrease the risk of diabetes and some other chronic diseases, whereas getting 6 or less or 9 or more can actually be detrimental. Another risk factor, which we know is for many other diseases as well, is cigarette smoking. The number of cigarettes smoked and the length of time of smoking are both proportionate to the increased risk of diabetes. And lastly, the most important risk factor we have control over as far as our risk of diabetes is keeping a healthy weight or maintaining a healthy weight. This can be done with all these things I talked about, with diet and exercise and adequate sleep. If you have any questions about your own risk of diabetes or what you can do to decrease your risk, as well as how to be screened, definitely talk to your physician about this, because there are many tests we can do that are simple that can give you an idea of your risk.